Our kidneys play a crucial role in maintaining overall health by filtering waste and excess substances from the blood, maintaining electrolyte balance, and regulating blood pressure. However, certain daily habits can put undue stress on these vital organs, leading to conditions such as proteinuria, the presence of excess protein in the urine, and even chronic kidney damage. This video explores these habits in detail, highlighting how they impact kidney health and providing tips for mitigating their effects. Just a quick disclaimer. Remember, the information provided is for educational purpose only and should not substitute informed medical advice or care. But first, let's understand what proteinuria is. Proteinuria is a condition characterized by the presence of abnormal amounts of protein in the urine. Normally, kidneys filter waste while retaining essential substances like proteins in the blood. When kidney function is impaired, proteins such as albumin can leak into the urine, indicating potential kidney damage. Chronic kidney disease is a long-term condition where the kidneys gradually lose function. Early stages might be asymptomatic, but as the disease progresses, it can lead to end-stage renal disease (ESRD), requiring dialysis or a kidney transplant. Identifying and modifying harmful daily habits can help prevent or slow the progression of kidney damage. 1. Excessive salt intake. High salt consumption is a leading contributor to kidney damage. Excessive salt increases blood pressure, putting extra strain on the kidneys. Over time, this can lead to hypertension, a major risk factor for CKD. How it happens. Sodium, a key component of salt, affects the balance of fluids in the body. When you consume too much salt, your kidneys must work harder to expel the excess sodium, which can lead to kidney stress and damage. Tips to reduce salt intake. Use herbs and spices to flavor food instead of salt. Avoid processed foods high in sodium. Read nutrition labels to monitor sodium intake. 2. Dehydration. Consistently not drinking enough water can harm kidney function. Water is essential for kidneys to filter waste and maintain the balance of electrolytes in the body. Dehydration leads to concentrated urine, making it harder for the kidneys to expel toxins and increasing the risk of kidney stones and infections, both of which can cause kidney damage. Tips to stay hydrated. Drink at least 8 glasses of water a day. Increase water intake during hot weather or physical activity. Monitor the color of your urine. It should be light yellow. 3. Overuse of painkillers. Frequent use of non-steroidal anti-inflammatory drugs or NSAIDs such as ibuprofen and aspirin can damage the kidneys, especially when taken in high doses or for prolonged periods. NSAIDs reduce blood flow to the kidneys, impairing their function. Long-term use can lead to chronic interstitial nephritis, a condition characterized by inflammation of the kidney's internal structures. Tips to use painkillers safely. Use the lowest effective dose for the shortest duration possible. Consult a healthcare provider for alternative pain management strategies. Avoid combining multiple NSAIDs. 4. High-protein diet. While protein is essential for health, excessive intake can strain the kidneys, particularly in individuals with pre-existing kidney conditions. High protein intake increases the kidney's workload to eliminate nitrogen, a byproduct of protein metabolism. Over time, this can lead to kidney damage and exacerbate existing kidney issues. Tips for a balanced diet. Limit protein intake to recommended levels 46 grams per day for women, 56 grams per day for men. Choose lean protein sources like fish, poultry, and plant-based proteins. Consult a dietitian for personalized dietary advice. 5. Smoking. Smoking is a significant risk factor for kidney disease. It damages blood vessels, reducing blood flow to the kidneys and increasing the risk of hypertension and diabetes, both of which are leading causes of CKD. The harmful chemicals in cigarettes cause inflammation and oxidative stress, damaging kidney tissues over time. Tips to quit smoking. Seek support from healthcare providers or smoking cessation programs. Use nicotine replacement therapies or medications if needed. Adopt healthier habits to manage stress and cravings. 6. Excessive alcohol consumption. Heavy drinking can lead to kidney damage and exacerbate conditions like hypertension and liver disease, which are linked to CKD. How it happens? Alcohol dehydrates the body and disrupts the balance of electrolytes, putting strain on the kidneys. Chronic heavy drinking can also lead to high blood pressure, further harming kidney function. Tips for responsible drinking. Limit alcohol intake to moderate levels up to 1 drink per day for women and 2 for men. Stay hydrated by drinking water alongside alcoholic beverages. Avoid binge drinking. 7. Sedentary lifestyle. Lack of physical activity is associated with several risk factors for kidney disease, including obesity, hypertension, and diabetes. How it happens? A sedentary lifestyle contributes to weight gain and insulin resistance, increasing the risk of conditions that harm the kidneys. Tips to stay active. Aim for at least 150 minutes of moderate intensity exercise per week. Incorporate physical activity into daily routines, such as walking or cycling. Find enjoyable activities to stay motivated. 8. Poor diabetes management. Uncontrolled diabetes is a leading cause of CKD. High blood sugar levels can damage the blood vessels in the kidneys, impairing their function over time. How it happens? Persistent high blood glucose levels cause the kidneys to work harder to filter blood, leading to kidney damage and proteinuria. Tips for managing diabetes. Monitor blood sugar levels regularly. Follow a balanced diet and exercise plan. Take medications as prescribed by a healthcare provider. 9. Ignoring sleep. Chronic sleep deprivation and poor sleep quality can negatively impact kidney function. The kidney's function is regulated by the sleep-wake cycle, and disruptions can affect their efficiency. How it happens? Lack of sleep can lead to increased blood pressure and higher levels of the stress hormone cortisol, both of which can damage the kidneys over time. Tips for better sleep? Aim for 7 to 9 hours of sleep per night. Maintain a regular sleep schedule. Create a restful sleep environment by reducing noise and light. 10. Overuse of supplements. While dietary supplements can be beneficial, overuse or misuse can harm the kidneys, especially when it comes to herbal supplements and high doses of certain vitamins and minerals. How it happens? Some supplements can cause kidney inflammation or interfere with medications, leading to kidney damage. Tips for safe supplement use. Consult a healthcare provider before starting any new supplement. Follow recommended dosages and avoid high doses unless advised by a doctor. Choose reputable brands and avoid unverified herbal supplements. 11. Skipping regular health checkups. Regular medical checkups are essential for early detection and management of conditions that can lead to kidney damage, such as hypertension and diabetes. How it happens? Missing routine checkups can delay the diagnosis and treatment of conditions that harm the kidneys, allowing them to progress unchecked. Tips for regular health monitoring. Schedule annual physical exams. Monitor blood pressure and blood sugar levels regularly. Follow up on any abnormal results with your healthcare provider. 12. Excessive caffeine intake. While moderate caffeine consumption is generally safe, excessive intake can lead to increased blood pressure and put stress on the kidneys. High caffeine levels can increase blood pressure and act as a diuretic, potentially leading to dehydration and kidney strain. Tips for moderating caffeine intake. Limit caffeine intake to no more than 400 mg per day, about 4 cups of coffee. Opt for decaffeinated beverages when possible. Balance caffeine consumption with adequate water intake. 13. Ignoring symptoms of urinary tract infections or UTI. Untreated UTI can spread to the kidneys, causing serious infections and damage. Bacteria from untreated UTI can ascend to the kidneys, leading to pyelonephritis, a type of kidney infection that can cause long-term damage. Tips for UTI prevention and treatment. Stay hydrated and practice good hygiene. Seek prompt medical treatment for any symptoms of UTIs. Complete the full course of prescribed antibiotics. 14. High sugar intake. Excessive sugar consumption can lead to obesity, diabetes, and hypertension, all of which are risk factors for kidney disease. How it happens? High sugar intake contributes to weight gain and insulin resistance, increasing the risk of conditions that damage the kidneys. Tips to reduce sugar intake. Avoid sugary drinks and snacks. Opt for whole fruits instead of fruit juices. Read labels to check for added sugars. 15. Overeating processed foods. Processed foods are often high in salt, sugar, and unhealthy fats, all of which can negatively impact kidney health. The additives and preservatives in processed foods can strain the kidneys and contribute to conditions like hypertension and obesity. Tips for a healthier diet. Choose whole, unprocessed foods whenever possible. Cook meals at home to control ingredients. Read labels to avoid high sodium and high sugar foods. 16. Consuming artificial sweeteners. Some studies suggest that overuse of artificial sweeteners may have negative effects on kidney function. How it happens? Certain artificial sweeteners can cause changes in kidney function over time, although more research is needed to fully understand the impact. Tips for moderation. Limit the use of artificial sweeteners. Opt for natural sweeteners like honey or maple syrup in moderation. Reduce overall sweetener consumption. 17. High-fat diet. A diet high in saturated and trans fats can lead to obesity, hypertension, and cardiovascular disease, all of which can harm the kidneys. Excessive fat intake contributes to weight gain and metabolic issues that increase the risk of kidney disease. Tips for a balanced diet. Choose healthy fats like those found in avocados, nuts, and olive oil. Limit intake of saturated and trans fats found in fried and processed foods. Include plenty of fruits, vegetables, and whole grains in your diet. 18. Holding in urine. Regularly delaying urination can lead to urinary tract infections and bladder issues, which can affect kidney health. How it happens. Holding in urine can cause the bladder to stretch and become less effective, increasing the risk of infections that can spread to the kidneys. Tips for healthy urinary habits. Respond to the urge to urinate promptly. Stay hydrated to maintain regular urination. Practice good hygiene to reduce infection risk. 19. Ignoring medication guidelines. Not following prescribed medication guidelines can lead to improper dosing and potential kidney damage, especially with drugs that are metabolized by the kidneys. How it happens. Incorrect dosing can cause toxicity or insufficient treatment, both of which can harm the kidneys. Tips for safe medication use. Follow the dosage and timing instructions provided by your healthcare provider. Discuss all medications and supplements you are taking with your doctor. Never share or use someone else's prescription medications. 20. Excessive protein supplements. While protein supplements can be beneficial for some, excessive use can strain the kidneys, especially in individuals without high protein needs. How it happens. Just like a high-protein diet, excessive protein supplementation increases the workload on the kidneys, potentially leading to damage over time. Tips for using protein supplements wisely. Use protein supplements only if recommended by a healthcare provider or dietitian. Opt for balanced protein intake from natural food sources. Monitor total daily protein intake to avoid excess. Our daily habits play a significant role in maintaining kidney health. By being mindful of our lifestyle choices and making positive changes, we can reduce the risk of proteinuria and chronic kidney damage. Incorporating healthy habits such as maintaining a balanced diet, staying hydrated, exercising regularly, and managing chronic conditions effectively can go a long way in protecting our kidneys and ensuring overall well-being. It's essential to be proactive about kidney health and seek regular medical checkups to detect any early signs of kidney issues. Early intervention and lifestyle modifications can significantly improve outcomes and prevent the progression of kidney disease. Remember, small changes in daily habits can lead to substantial improvements in kidney health and overall quality of life.